One more time. LPNs do not triage. Let me say this again. This isn't any hate. They can do all kinds of other things, but they do not do a complex assessment, which is called triage. Don't let organizations tell you you're going to collect data. You're going to be just calling patients, especially in a state that you don't possibly hold a professional license in. It is not within an LPN's educational training to do a complex assessment. That is literally the definition of triage. If you allow your job to dictate your scope, you can end up in front of a board of nursing. You have a scope of practice that is to you that you're supposed to know and adhere to. And you said you would when they handed you your license. So we don't care what the organization says. We don't care what the job description says. No. Because that's just going to be played out that you are greedy and doing stuff for money. And let's just talk about integrity. I digress. And now you're a nurse. No. LPNs do not triage, period, the end. There is no ifs, ands, or buts. There is no education that supports that across the United States. Please hear me when I say this. Let me say it again. LPNs do not triage, no form of that ever. If you choose to do that as an LPN, then you're placing yourself at risk to be reported and disciplined by a board of nursing because you are acting outside your scope of practice. Make sure to get yourself professional liability insurance as well. All of us, every one of us. And if you're an RN signing off on practices that were delegated to an LPN that are not within their scope of practice, and now this is tied to billing, I just did one about this, please. You know why I'm saying this, right? Because more likely than not, nurses have come to me and now they're dealing with issues with the board, civil or criminal. So I'm not just making this stuff up out of nowhere. Please heed my words when I tell you this is not a practice that you're allowed to do. No one's hating on the LPNs. I'm actually trying to educate. So RNs, don't get involved with this either. You cannot be signing on stuff nor delegating tasks. They're not even within the scope of practice of an LPN. Don't be doing this stuff.